It's saying preparing, but it is very possible that they are seeing us.
Yes, they are seeing us. Hi, everyone.
Yeah, it always shows the before the before. So welcome everybody. We're so glad you're here, and I do believe we're officially live and on Facebook. So Facebook friends and colleagues and community that we have on our Market America Facebook page, thank you so much for joining us. Let us know, chat in, say hi, let us know where you're coming in from. We definitely want to hear from you, and definitely chat with us as we go along in this Zoom. I am joined by two incredible health professionals. We are going to be talking about digestive health. I'm going to start the webinar. Don't you worry, Sosan. And we will get started here because I got about a minute. So we are, yep, no worries. She is keeping me on target. Way to go, Sosan. All right.
Hi, everyone.
Excellent. All right, so we are on Facebook and now we're on Zoom. So welcome Zoom as you're piling on to the Zoom. Please say hello, let us know where you're coming in from, and definitely chat with us as we go through. We're very, very excited to be here. So without further ado, let me go ahead and introduce my very, very special guests. I'm so excited that they're here. We have, I'm just going to change our view here to gallery. There we go. We have the incredible Tina Rose, who is a certified women's healthcare nurse practitioner and has been, you guys, for 34 years. She is a founder and owner, Just Us Women Health Center in Massachusetts for 11 years. She focuses on integrative women's health for optimal physical, mental, and spiritual health. And her subspecialty is hormone balance and weight management. She's a wife, she's a mom. She's got 2 daughters, a son, and 2 grandsons, and 2 more on the way. So she is incredibly busy and blessed. And we're so blessed to have her here to tell us a little bit about digestion.
Oh, thank you so much, Melanie and Sosan, for inviting me to join you tonight. I can't believe how excited I am to A, be among you two superstars, and B, talk about one of my favorite topics, digestive health or gut health, which I just feel is so important to my patients, to my family, everybody. I think sometimes my patients might think my other specialty or my specialty is that other G specialty, gastroenterology, but it's really gynecology. But seriously, I do end up discussing gut health with most of my patients, especially if they have any complaints, whether it be they're feeling anxious or they're tired all the time, or they just feel like they've got inflammation, bloating, whatever it is. I feel that it always really relates back to their gut health. Even if they don't have any complaints, the very least I will do is ask about their bowel movements.
Yes, in the health professional, we're very used to talking about bowel movements. So we may mention those a few times this evening, and don't be alarmed. We're gonna have a ton of fun as we talk about this in this really important topic, and our next, obviously a pillar of our TLS community here. Sosan is our director of TLS training and our registered dietitian for over 18 years. She's an entrepreneur with her own successful practice. She's also a certified diabetes educator. She's a weekly guest on a health and wellness radio show, and she's been a TLS certified coach and trainer with us for years. And she's also a wife and mom of 2 very beautiful little girls. So we have incredible women. Sosan, I know that this topic, it has a special meaning for you specifically.
Yes, it is. Like you said, I specialize in diabetes, and for the longest time, I never thought I would talk about gut health, because I specialize in diabetes, but it's so prevalent. And when you start talking about people, I'm sure, like, I just want to even ask people that are right now joining us, how many of you know somebody who suffer from some form of digestive problem? Like, let's talk about bloating. We talk about like constipation, right? Diarrhea. We're talking about some people who even has like immune problems, skin hair. But what's really dear to my heart is because I always thought, I actually volunteered for the Canadian Cancer Society for the longest time. And I never thought that something like cancer or anything are affecting any like younger people. We always think it's always the older people that get affected. Unfortunately, a few years back, actually, now thinking about it, I'm thinking about 2 years after, before COVID, everything is a blur. So it's about 4 years back, a friend of mine who actually passed away from colon cancer, and she was only 36, and she left with two beautiful children. One is 10 and one is 8. And when I learned about her family history, not her family history, but her history, with she was having a lot of digestive issues since she was a teen, and she thought that was normal. So it's so prevalent. And when you think about cancer, we always worry about breast cancer and prostate cancer and lung cancer, but colorectal cancer is actually rated number 3. So besides breast and prostate that affect men and women, the second might be lung cancer. Number 3 is colorectal cancer. That's something that we're going to talk about today. Yes, we're not really talking about cancer, but taking care of your digestive health is the beginning of preventing many of the diseases. And my friend was really a wake-up call. Now, like Tina said, I ask all my clients, I ask that question because I cannot assume just because they don't complain about it that everything is fine. So I'm really excited to talk about this topic because aside from diabetes, this is probably another D that I like to talk about, which is digestive health.
Yeah, definitely. I know that we have a lot of people, on the Zoom raising their hand, talking about, hey, I have issues. My family has issues. It's like passed down in generations. I know that that's true for my family. It was just like, oh, well, we all have that,
Yeah.
and wait a second, like, do we need, maybe we should address this and not just think it's normal or this thing we all just have. And so that's why we're here tonight. We're really bringing awareness. We want to bring prevention and education to this topic because it is so important. I mean, even if you're chewing down the Tums and the Pepto-Bismol and, these types of things, those are signs that that digestive system is not functioning properly. And so you might not think that that's a sign. Right. And so this is where we're going to bring that awareness. And we thought that we would start with a little brief and fun biology lesson. We're all excited about this because it's our background. And so I'm going to go ahead and bring up a little visual here because I think this is probably some of the most complex, plumbing in your system. And so it really starts from here and it ends on the other side. And we have a quote in our company that you'll hear many of our health professionals say, including Tina Rose, is the road to good health is paved with good intestines, right? And so before we get really into the data, we just want to put up our disclaimers that these statements have not been evaluated by the Food and Drug Administration, not intended to diagnose, cure, or prevent any disease. Individuals following the TLS weight loss solution, because that's who we are. We are all about TLS and a healthy lifestyle. Consult your health care provider before starting on any program, product, or exercise program. So let's dive deep into what is going on. And the reason I think this is important is so that we can all be advocates of our own health. When you go into a health professional's office and they tell you about all these organs and you don't know what those organs are or what they do, you cannot be an advocate for your own health. So great digestion starts with the mouth, starts with chewing. That's step number 1, right in the mouth. And this step, if it's not done properly, the rest of the digestive process can be compromised. And so this is very, very important. And you probably know, like, my husband is a food inhaler, right? I have to tell him, slow down, take smaller bites, chew your food, please, right? Because I know what happens when those big chunks of undigested food are passing through this complex system. And so it's really, really important. One of the major players as far as enzymes go in the chewing is amylase, which is starting to break down those starches. So this is really that first step in breaking down your food, both mechanically and from a chemical or molecular standpoint with the digest or with the enzymes. So that leads us to the stomach.
Yes. So digestion actually breaks down to two parts. So first part was the mechanical, what Melanie was just talking about. The mechanical actually continue on to the stomach, because in the stomach it actually does two things. First, it releases digestive juice, which is very corrosive. Okay, these are so corrosive. Means that if it's so corrosive, how come our stomach can handle it? Because we have the stomach lining that's these mucus to kind of. I always call like your gloves when you're touching, like, I don't know, bleach and you're wearing your gloves. Your gloves is that mucus to protect your hand while you're playing around with bleach. In this case, is your digestive juice mixed with enzyme, and the particular enzyme that works here is actually a enzyme called pepsin, which is helping to start to break down protein. So think about your stomach as inside has the muscle, and the juice and the enzyme combined with the food is breaking down into a useful form. And I like to call it like, imagine a blender blending everything up to make a usable form so that they can both start to go into the small intestine where the rest of the digestion happens.
Yeah, absolutely. I think the job of the stomach, correct me if I'm wrong here, Sosan, is to make things isotonic.
Yes, it does make things isotonic. And that's what when they enter from the stomach to the small intestine, they're actually considered a chyme, which is CHYME. And this is at a certain concentration, osmolarity, and in terms of the pH to mimic so that, because if not, can you imagine, I just told you right there that the stomach is, the acid is very acidic. It's corrosive, right? And the small intestine doesn't have that protection. So it needs to be in the isotonic to protect that small intestine, but also to ensure that it has a very smooth and increases the chance of absorption. So every step is, I imagine, a multiplayer working together every step of the way to make it done right. Like Melanie said, if you inhale food and you don't mechanically digest your food, the stomach has to do a longer work to digest that food that uses inhale. So that's why in long term causes a lot of stomach distress. And now move on to the small intestine. And
well, actually, before we get to the small intestine, something else comes into play.
Yes.
And Tina Rose, what comes into play before we hit the small intestine?
Well, it's the liver and the gallbladder. Yep. So we're going to start with the gallbladder. And I always think the gallbladder is probably the least respected of all the digestive organs, because how many people out there know somebody, or they themselves have had their gallbladder removed, right? And usually you're not going to miss it too much. So basically the gallbladder is that little green pouch. It actually is not very size specific in this diagram. It's a little bit bigger than that. It's this green pouch that sits below the liver, and it holds the bile, which is that greenish fluid made up of bile salts and fluid that's produced by the liver. 50% of the bile that's produced by the liver is transported to the gallbladder for future use. And then the other 50% is deposited into the small intestine. So before a meal, the gallbladder is about the size of a pear. So it's a little bit bigger than it looks in this diagram, but it's filled with bile. And then after a meal, it's more like a deflated balloon. So maybe this is a deflated gallbladder here, because it secretes out the bile to aid with the digestion of the meal. And bile is basically used to convert fats into the fatty acids, which are absorbed by the gut. It acts as an emulsifier, kind of like that blender Sosan was talking about, to break down those large fat globules into smaller little fat droplets. And this increases the surface area of the fats so that it can interact with the enzyme. In this case, it's the lipase, which digests or breaks down lipids to digest the fats. And the bile is really like a solvent that allows those fat droplets and the lipase to interact with each other. Bile salts are very important for the absorption of those fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K. And it's also very important for the elimination of waste and the removal of toxins, which is really the liver's main job, right? So if we move on to the liver is probably one of the most highly respected, and because it's a vital digestive organ. We cannot live without a liver. So it is located in the upper right abdominal cavity, right below the diaphragm and above the stomach and the small intestine. And you can see it has two lobes. There's the larger right lobe and then the smaller left lobe that's more towards the inside of the body. It is a dark reddish brown color. We've all seen beef liver, right? It's that slimy brownish red color. It's somewhat cone shaped or more cap shaped. And it gets its color because it is a very rich blood supply. It actually holds about 13% of the body's blood, which is about a pint. And basically the oxygenated blood, the red blood, is brought to the liver via the hepatic artery, and then the deoxygenated blood is taken away via the hepatic vein. All of the blood, via the blood vessels and the capillaries that are leaving the stomach and the small intestine, has to pass through the liver. So the liver was going to process the blood and breaks down and balances and creates these nutrients. It also is very important for metabolizing drugs into forms that are easier for the rest of the body to use, but also that are in a non-toxic state before it passes through the rest of the body. And as I already mentioned, the liver produces all that bile, which gets transported to the gallbladder and the small intestine. But cholesterol is also produced in the liver, which accounts for most of the cholesterol in our body, not necessarily from the foods we eat, like people think if your cholesterol is high, it's because of you're eating too much cholesterol. So our fats can actually help the liver to make more cholesterol, and that's where we can get too much. But basically, the liver will break down harmful products and excretes it into the bile or the blood. The bile byproducts then will enter the intestines to leave the body as feces, and the blood byproducts will get filtered through the kidneys and leave the body as urine.
Yeah. So basically, it's a big filtration system. And I mean, what happens in your car when you don't change your oil filter or your fuel filter, or you have to change your AC filter. I mean, the filtration is so important. It's like when we say drinking water, right? Drinking water, if you don't have filtered water, you are the filter. And so the liver is this incredibly important filter, so that we can, like Tina said, excrete those toxins, and we don't want those toxins in our system and staying there. So going to the small intestine now, because now we've gotten the starches, the proteins, the fats, they're all being broken down in different stages, you guys, and then going into the small intestine for a very important function, which is, Sosan?
Absorption. So basically, I was mentioned the first half of it was more mechanical digestion, the second half of it, which is more the chemical digestion. So actually, there's a little part that's very quickly I want to mention is that pancreas. I want to talk about pancreas. I love pancreas. But very quickly is what the job of the pancreas, it releases those key digestive enzymes, which we know as things to break down your protein, protease, things to break down your fat, lipase, things to further break down your carbohydrate amylase. So pancreas are very important because they release these enzymes. Obviously, they also release hormones, and one of the hormones that we know is insulin. But today we're not going to talk about diabetes, so we're not going to talk about insulin. But very quickly, once they release that, so the digestion, so the majority of digestion is still happening in there's three parts of the small intestine. You see there is the duodenum. This is where they kind of complete that digestion. The rest of the absorption kind of takes place in the second two part of the small intestine. One is the jejunum and the other is ileum. Just know that the first 1/3 of it is finish up the digestion from the stomach. The 2/3 is response for absorption. So when we want to absorb nutrients, that's why your small intestine, the health of your small intestine is so important, because that's where absorption of nutrients is. You are what you eat, but you are what you absorb. And that's all taking place in your small intestine. So now we go to the third part. Okay, you are what you eliminate. So let's talk about the large intestine.
Exactly. So you guys can see how crucial these little pieces are to really the end result, and what needs to happen before this last organ finishes the job, right? And that is to eliminate essentially whatever is left over. Now, improperly digested food and broken down food consistently over years of just eating what I would consider the wrong foods, or just inhaling our foods, can cause digestive concerns and symptoms. And so what happens in the large intestine is really this 5 feet, you guys, 5 feet of this very important plumbing, essentially. And one of the things that it does is it actually recovers water and electrolytes, which is obviously important, but that formation of the feces. And why I'm doing this is because there's this movement that the large intestine essentially has a muscle movement called peristalsis. And that movement is moving along this, basically what Tina Rose so perfectly described as, the toxins and anything that's basically undigestible. Now there is over 500 bacteria in the large intestine that is called the bacteria flora, or you might have been referred to it as biome. And this digestive system, they are fermenting and breaking down whatever is at this point indigestible. And there's a very symbiotic relationship that they have discovered between the gut, then this bacteria, and our brain. And they call it the enteric nervous system, which is this second brain in the body, because it really impacts the way we feel. It can give us a conscious feeling of even things like unease or anxiousness when things are not balanced in our digestive system. And so there has been research and books and you name it about this symbiotic connection that's happening in the large intestine. And one of the major functions that happens through this, the bacteria and all of the rest of it, is the production of vitamin D. Let me see here. I want to make sure that I have, vitamin K, vitamin K. I'm going to read my own writing. And so we have, some really important functions that happen, that impact the immune system, that impact our hormones. And so again, I'm going to come back to this really important concept of, if you know the function of your body, you're probably more likely to make smarter decisions about what you're putting in this part of, into your face, essentially. One of the things too is this stimulates the small intestine, and this enteric nervous system stimulates the release of hormones involved in storage of fat, which really translates to our weight loss conversations that we have a lot, right, Sosan? We're constantly educating on weight loss. And so digestion and the quality of your digestion is really going to impact your healthy weight, your inability to lose weight, or possibly that you're gaining weight and you don't know why. So this is all very connected to our main theme that we have in TLS. So moving on here, now that you've had the biology lesson and you're like, enough, you guys, let's move on to some tips, some usable tips, some things you can do that will improve your digestion, because that's really what we're here to do, is help you, really take care of your digestive health. So let's start with Tina Rose. Take it away.
All right. Well, my number one tip is going to be hydration. We need lots and lots of water. The adult body is basically about 60% of what is water. And we know how important water is just for life, any life. But it's also very, very important for digestion. And that's why it's my first tip is to drink more water. Back when I used to practice obstetrics, I would emphasize the importance of hydration to all my pregnant patients. And I used to say, hydrate, hydrate, hydrate. And when you're done hydrating, drink some more water. And now I say the same thing with, any of my patients with that, whether it be for weight loss, hormonal balance. It's my first line of defense, especially if anybody has trouble with that elimination process. So hydration is necessary for every aspect of digestion, from the saliva in your mouth that Melanie had spoken about, where digestion actually begins, through the movement in the small intestines, like Sosan had said, and all the way to the absorption of water into the large intestines to aid with the elimination of those wastes. So how much water do you think you should drink? Well, that depends on many factors, such as, are you male or female? How old are you? What is your weight? Do you exercise? What's the weather like outside? All these things can really impact how much water you really should have. Usually you can hear about 8 glasses of water a day, 64 ounces. I personally don't think that's enough. I tend to recommend a minimum of 10 glasses a day. But with certain conditions, you might even need more than that, particularly if you're having any digestive issues, such as trouble eliminating. And so that is my first major tip. And now my next tip is, and Melanie already addressed this really, but I like to actually think of it more as conscious eating. Take the time to chew your food. And like you said so eloquently, Melanie, too often in today's world, we're just so busy that we just don't sit down to really enjoy a meal. Unless maybe we're out on a date and eating in a restaurant where we take the time to have an appetizer and then we order our main meal and might have a cocktail. That's when we're really probably consciously eating. I know I'm really guilty of this. You know, whether I'm in my office all day seeing patients, I'm usually eating lunch at my desk while trying to get all my notes written or answering phone calls in between bites. And it often feels like it's not just our husbands, Melanie, but we all can inhale our food. So my second lifestyle tip is to really just slow down when you're eating, not necessarily when you're exercising, right? No. Remember that digestion does begin in your mouth with that chewing. And that chewing is really to break down those larger food particles into much smaller particles. So they can fit down that esophagus tube without getting stuck and choke, get into the stomach. But also, if you don't take the time to really chew, first of all, you're not going to get the flavor of your food so that you can really enjoy it. But you're also, prevents the enzymes to go in and emulsify, those enzymes that start in your mouth to come into contact with more of the food.
Yeah.
And then, go ahead.
No, go ahead.
No, what were you going to say?
I
was going to move on to my
perfect
big tip. Sleep. Second to gut health being so important to overall health, sleep. We know we cannot function without sleep, but our digestive system cannot function without sleep. It really is so important that we get not just enough sleep quantity wise, but also the quality of our sleep. Because if you think about it, that's when your entire digestive system and every system in your body is resting and not using up as much energy. Our metabolism is resetting itself. The water balance is going to be a lot of the elimination is going to go through the body. How many people who have a really good, healthy digestive system are going to eliminate first thing in the morning? I'm one of them. That's because all night long that peristalsis is working and all those wastes are being removed while we sleep. So when we don't sleep enough, the digestive system just isn't going to work properly. Whether it be your metabolism, whether it be making those enzymes, the reduction in the stomach acid, all of that is just recouping itself while you're sleeping. And so particularly when I'm dealing with weight management, I often tell my patients, if we're not dealing with sleep first, we're barking up the wrong tree. And I think that's what differentiates TLS from so many other programs out there, is we really want to get at what is leading to the poor digestion, what is leading to the weight gain, and oftentimes stress, but also sleep. So
absolutely. Yes, we did last month. We did the whole thing on stress. And I always like to let people know that movement is another really important factor to help the digestive system along. Especially if you find that your digestive system is a little stagnant, it's probably because you are. And so it's one of those things where if you move, guess what else moves? Your bowel movements. And so stretching and yoga and walking and, these types of things, which are also very good for de-stressing, because if you think about it, what do you do when you're scared and you stressed? You clench your, what? Yeah. And what do you do? What's happening when you're clenching, right? You're stopping the digestive process. And so it's really important to take this, what I love about movement is how much it typically focuses on breath. and breathing and, getting aware of where the body is sitting. And so movement is also really crucial to continuing to have a healthy digestive system long into life. Great tips, Tina. Thank you so much for those. And Sosan, you are going to be talking a little bit about what we need to avoid, especially if we have digestive concerns.
Yes. And the first one is the white thing, the white flour. So let's talk about what white flour is. So, a typical thing is when people think of white flour, they say, oh, I don't really eat white flour. Let's translate them to the food that you usually eat: bread, crackers, cake, muffin, donut. Should we put the list on? Pasta. So what did you have for dinner today? I'm trusting that unless you're following the TL's lifestyle, you must have something that has flour in there. Okay. It's such a big part of a diet. And the type of flour that we're eating is I would say so devoid of nutrient. And I want to add one more thing before I talk about why this is such a not a greatest thing in terms of improve or affecting our digestive health. It says, just think about it. When we eat food, our digestive system, okay, release these enzymes to break down food. When we eat natural food has enzymes. Fruits and vegetables has enzymes. So when we eat flour, guess what we do? Instead of supporting our digestion, we actually, you know me and my analogy. Instead of depositing some money, you actually constantly withdraw the money, withdraw that enzyme to break down your food that you're eating every day. And this is why a lot of people said, why would I need digestive enzyme, which we will talk about later. This is one of the reasons why, because you withdraw so much that you need to get money from somewhere, because money is supposed to come from your natural food, wholesome fruits and vegetables, especially your vegetable. So when you're eating these foods, you are actually having your body work extra hard to break it down. And second, I love how Melanie said, and I always say it too, this is like glue. Think about what flour is. It's sticky. It actually makes your digestion very slow in that sense. And you said, no, white bread breaks down very fast. Yes, but it's a glue. It's sticky. So it makes everything kind of like, just imagine you have a sticky glue with you. How sticky it is and how long it takes to break down. And that's why in long term, not only it doesn't support you, it's devoid of nutrient, like especially the B vitamins. We need B vitamins so much. And flour, as whole grain flour, you might have those B vitamins, but white flour, you have nothing. All you get was calories, and last but not least, it's gluten.
Yeah.
We know glutens are not great, but guess what? All flour has gluten in there. And people say, what if I choose gluten-free? Gluten or gluten-free? Gluten-free are very high in GI, high glycemic index. They're not great from health, but from a gluten perspective, it really put you at a higher risk, and it does increase inflammation. So I always say that whenever you eat these flour and you feel bloated afterwards, that's a very good indication that your body does not like it. You might want to avoid it. You might want to deny it, but you cannot, I would say you cannot deny, like you deny the symptom, but you cannot deny the fact that in long term, after you finish eating, if you feel like 3 months pregnant, there's a reason why you feel like 3 months pregnant, okay? It's the gluten, it's the flour that's devoid from nutrients. I want to talk about the second one, aside from the flour, is dairy. We are a country, a Western country, who loves dairy. I don't think I know any more country such as US that love dairy this much. Think about breakfast, lunch, and dinner. Breakfast, your milk. Lunch is your cheese sandwich, right? Dinner could be maybe, I don't know, you have something, you say, oh, have something healthy, and you have a yogurt with that, a typical concept. But dairy everywhere. When you have your coffee with your cream and your milk, whatever it is, or your cereal, we eat way too much dairy. And you said, well, dairy has calcium. Well, it has been proven that the calcium in dairy are not supporting from a osteoporosis or from a bone support. It has proven to be true. I want to really add that in Canada, since 2018, we actually take away this whole food from our Canada's food guide, which is a huge deal. For them to remove the whole food group from a government standpoint, you know what's that telling you? We don't need it. We really don't need it. We don't need it for nutrient. We definitely don't need it for health. Second thing is dairy has been proven, has been shown consistently over the years that it increases inflammation. And one of the things that you often hear about leaky gut One of the reasons we can is we eat way too much dairy, but we eat poor dairy choices. We don't eat, and people say, well, if I eat grass-fed dairy, yes, they're slightly better, but in the end, there's other reason why I would say this is not your everyday food. I treat this as your wine. You can enjoy every now and then, but not the thing. When you have wine, breakfast, lunch, and dinner and say that you're eating a healthy meal, you're not going to do that, right? And that should apply for dairy. So dairy actually are very inflammatory, and in long run really has been shown to really causes a lot of digestive distress. And then last but not least was the lactose, right? So last but not least is talk about this unhealthy fats, right? People has this misconception of, for the longest time, we're always into the whole low fat thing. And now has been proven that we actually need healthy fats because we need fat to absorb these fat soluble vitamins, but we don't need unhealthy fats. And these unhealthy fats are hydrogenated oil or what we call highly processed vegetable oil. This is not your olive oil. This is not your omega-3 fat. We're talking about things that I just mentioned, your bread, your pasta, your cookie, your donut. These are the food that you will see these digest. That's why I always think about food is never in silo. They kind of package together. These flour and oil and the dairy kind of package together, right? They always come together. And that's why it's never one food that really affects you. It's really these three foods combined together on a daily basis that really affects you. And it has been, again, shown that it's very inflammatory. Anything that's inflammatory hurts your gut. I always say anything inflammatory hurts your gut. So the more inflamed you are, the more digestive issue you tend to have. And that's why we need to work ourselves. And I totally agree with Tina. If we don't address a weight loss issue, let's talk about how we can take care of our gut. Because when we take care of our gut, almost maybe for majority of people, maybe 80% of the problem is resolved. Now the 20% will be so much easier because you resolve the biggest chunk of the problem, basically.
Yeah. And that was definitely true for me in my own personal journey, in my own weight loss, and also in my own health. I started to experience digestive distress in high school. And as a young adult, I started addressing my diet and what I was putting in my body, and, living on macaroni and cheese and grilled cheese sandwiches and, Doritos and, these types of foods that I just didn't know were unhealthy at the time, but were really hurting me. And, potatoes and dairy were like a staple, and so eliminating these, and I didn't do it all at once. Right. And we're not asking you to do everything all at once, right? This is a journey. This is a process. And so when I eliminated flour and dairy, big things happened for me. Mm-hmm. And, I always tell people that flour, my grandparents used to put wallpaper up with flour and water, and it would stay up for years.
Yeah.
Okay. And so, when Sosan says it's glue, it truly is, it's when you're a kid, did you make paper mache ever? Did you ever make anything with paper mache? Right. Is it's glue, and then it's like hard as a rock forever. And so, you got to burn that sucker if you want to destroy it. So first it's glue, then it's hard as a rock. And that, literally coats the small intestine, making it almost impossible for proper nutrient absorption. So flour is flour is flour. I don't care how special it is. It does not look like the plant it used to be. Okay. And
process.
Yes. And unless you have ears, a long tail, and are looking to be 400 pounds like a baby cow, we really aren't biologically meant to consume dairy. We have our own milk supply when we're born. And after that, it's just purely for pleasure. And so, yes, we have dairy in some of our TLS plans. I know some of you are thinking this right now. You are going to see some changes to that coming forward and moving forward. And so we want to start that conversation of just really understanding that dairy creates inflammation, dairy creates weight gain, and it isn't a necessary nutrient or food group. And so
I would love to tell a little story here as my parents came over from another country and dairy was a sign of health and wealth. I was hospitalized twice before the age of 5 for constipation. because I drank so much milk because my mother kept pushing it on. I was a skinny little kid and felt like they had to fatten me up like the fattened cow. And I drank so much milk that I had major issues with constipation and ended up in the hospital twice. So we think, oh, our kids need milk.
Yeah, it really is being proven through research and science, and you're going to see a lot of books on this topic. It's already being talked about. This conversation has been around for years. I've known about this for over 17 years. So dairy is something that, we're evolving towards moving it out of our TLS programs. And so you're going to see these changes come to full fruition, because it is a health thing as well as a weight loss and inflammation thing. So we're very excited about those changes coming down. Now, obviously, there's a lot going on in the digestive system, right? And so there are some ways that we can support the process and really begin to either create more balance or more health or more vitality in our system by adding some things to our regimen. And so I'm bringing up a website. Now, if you were a guest today and you've never seen, myself, Melanie Nelson, and I see I have Market America still there, and Sosan, and even Tina Rose, if you're not familiar with us and you're a guest here, you may have never even heard of this website, but I want you to wait before you go. I want you to get the link to the person who invited you here, because if you don't own this website, the person who invited you here does. And so they have, as you can see here on the screen, this is mine, Melanie D. Nelson. So we want to make sure that you get to the person's website that you are supposed to, okay? Because it's similar to a franchise. It's going to look just like this. It's going to have the same things we're going to talk about. And we have we have free programs, we have free resources, but one of the things we do is obviously supplements. And so we have incredible supplements to support your journey. You don't need to be on all of them, but we are going to talk about some of the ones that have to do with digestion. Now, one of the things that's become really popular, right? Everybody is detoxing. Right? It has really become a trend, and this is a good trend. However, not all detoxes are created equal. Okay. I did some very harmful detoxes in my past. Anybody else? And so, I mean, it actually made my digestive system worse after doing it, because it just was way too extreme. And what I love about this detox is that everybody can do it. It is so doable. It is so gentle. And there are, even if you are feeling challenged by it, there are ways to really, help you. We have tips. Okay. We've got solutions. Don't you worry. Now there's several things within this 7-day kit, including our fiber, which I'm going to talk about next. So I won't talk too much about that, but it has some really incredible botanical, supplements that you take throughout the day, and these get your digestive system moving, really cleaning out that colon, that large intestine we talked about, eliminating the feces, getting that, we call it the poop chute, right, for a reason. And so take with caution. The ones in the evening are the Hapata Cleanse, which is actually a supplement you can buy on its own and just take on its own, because it's very, very good for the liver. And that, as we talked about, is a filter for your body. And so this is actually filtering, really so many systems in the body, all in 7 days, following a very specific meal plan, drinking lots of water. We have a tracking sheet. We have all the tools so that you can successfully go through this 7-day cleansing system to really address multiple aspects of that digestive system. And we suggest once a quarter at the most is really a good idea for our detox. And there's a small jar of this particular product within that detox kit, but you can also buy it in a big jar, which I always have on hand because I have a scoop of this every single morning and I love it. I put it in my trim tea and I do it about 20 ounces of water, trim tea and the fiber. You can take it on its own. just in 8 ounces of water. You know, people are always doing the Metamucils and things like that. So people are familiar with this concept. Now, you know, what makes ours so incredibly special is it also has probiotics, which is really important, something that Tina is going to talk to a little bit. But what I love about our product pages here, you guys, is if you want to see what's in this product, and again, one of the things that makes this so special is the L-glutamine, which really helps support that gut-brain connection. It's very, very important ingredient. And so this is really what I love about fiber is it really scrubs away at the digestive system, really cleaning, but it's also absorbing toxins to shuttle them out of the body. So it's, you know, and fat. I mean, fiber naturally in our fruits and vegetables, or our vegetables are really our highest fiber foods. And whole grains, but I hate saying whole grains because people think of cereal, and that is not a whole grain. Okay,
whole grain bread, which is
not a whole grain, right? When I'm talking about the actual seed that you have to cook or put in the pressure cooker, or, you know, the actual grain, and that is incredibly high in fiber. And again, scrubbing away at the system and absorbing fat and toxins and bringing them out of the body, which is why fiber is so great for your digestive system, but also for weight loss. And so I take this every day, especially because you never know when you're going to have those days where you're just not getting in enough fiber. And we need about 35 grams of fiber per day. And this one has, let me see here, the soluble is 5 grams, and the inulin is another 5 grams, dietary fiber, 9 grams. I mean, we got all kinds of good stuff in here, you guys. And I love this fiber. So these are, you know, I do the detox once or twice a year, and I have my fiber every day. So I love this product, just like Joyce does. All right. Who's up next? Tina, you're up next. What are your favorite digestive products?
My favorite digestive products, both in my household and in my practice. Number one is digestive enzymes. These products, this is, I can't keep it on my shelves. It is number one for the digestive system. You heard us all night long talking about enzymes. We talked about the liver making some enzymes, the enzymes in your mouth, the enzymes from the small intestine, the enzymes from our food that Sosan talks so eloquently about, right? It's all the enzymes. Basically, the enzymes are going to break down our foods. We need them in order for digestion to occur. One of my favorite things that I will talk to my patients about when something ails them is I tell them that they're malnourished. And most of them are weight loss clients. So they say, look at me, there's nothing malnourished about me. And I have to say, no, I didn't say you were malcaloric. I said you were malnourished. You're not getting the nutrients out of your food. You're getting all the calories, but you're not getting the nutrients. In order to get nutrients from our foods, we really need to have those digestive enzymes, which we should be getting from our foods. What I think has happened over the years with the American diet, the SAD, the standard American diet, is everything is processed. And in the processing of the foods, we don't have those enzymes that we're going to break them down with. So therefore, we're not breaking down those foods because we don't have the right enzymes to break down chemicals. We have lipase to break down lipids, and amylase to break down starches, sucrase for sugars. Well, all of those ACEs are in these little packets, and they're isotonic, which means the same pressure as your body fluids for maximum absorption. It also comes in a big bottle. So in our household, we're going away on a little trip tomorrow. So we take our little packets of enzymes. My husband loves these. And I think, you know, for people who really don't have a great diet, they need them even more because you're not breaking down those foods to get the nutrients out of them. So when I look at this and I say amylase, protease, cellulase for all that cellulose, again with the starches, lactase to break down those milk sugars that we should be avoiding. But this is my favorite when I do indulge in an ice cream, about the only dairy I ever have, and that might be once a quarter. Lipase, again, sucrase, and it's got digozyme. And digozyme is a trademark blend of all of these different enzymes. And what makes this also so special, just like the NutriClean fiber powder, is they also add probiotics to it. So we're really trying to enhance that the digestive biome again with more probiotics with these enzymes to break down those foods that we might not be breaking down because everything's so processed. And therefore, if you don't break down the food, you're not going to get the nutrients from them. And that's when people will start gaining weight too, because they're not, their food, their body is craving some of these nutrients. And just because they're eating them doesn't mean they're getting the nutrients. And that's where the digestive enzymes come in. It does come in a 90 serving bottle too, which we always have in our household because my husband takes them several times a day. My son, I have a 19-year-old son, and talk about inhaling food, he'll eat the entire pizza and he'll say, "Oh, Mom." And I just point to the cupboard and said, "Get the enzymes." And it works quickly because it's isotonic. So you can actually feel that food being digested and emptying out of the stomach and into its intestines, where the absorption can occur for those nutrients.
Yeah,
Now,
it's
if
one
you
of
scroll up
those.
a little bit more with the all the supports right there. Yeah, it does so much. My favorite, not my favorite thing about, I have so many favorite things about this product, but talk about a bang for your buck. It is so cost effective to use daily, twice a day. So many people in our society, in our country, in our standard American diet, have indigestion or problems with too much acid production. And this can really help ease that stomach upset. The occasional stomach upset promotes the digestion of nutrients that I talked about, all the enzymes and the good bacteria, just to really support that healthy digestive tract, which when we have a healthy digestive tract, we're going to support all of our immune functions as well as our hormonal functions too. Healthy skin. I always say I refuse to look like the grandmother I am. You mentioned I had been practicing for 34 years. I like to say I started when I was 10. Not so good. And basically that barrier function too. So it really aids in the elimination process, and just a phenomenal product. I have more patients in my practice that are on auto ship for this and my other favorite product than anything else. And I'm technically a women's health. People think I'm just reproductive health, but
Can I just tell this is one of my favorite products because in weight loss, often people are moving from a processed diet to one that has fruits and vegetables. And when your body hasn't been making those digestive enzymes, because your body doesn't do anything it doesn't need to do. So if you're not eating fruits and vegetables, it's not making those enzymes for you to break it down. And so what happens is people are like, vegetables give me gas, right? And it's like you start eating healthy and suddenly you can't be in the boardroom because you don't know, you can't control what's going to happen, right? You're just like, you've got flatulence, you've got, it is like you're Dutch ovening your spouse, they're telling you need to sleep on the sofa. This is a common thing when people are moving from a processed diet to one that's rich in whole foods. And what I always say is if you can eat pizza and Doritos and be fine, but you have broccoli and whatever, pick another vegetable, cauliflower, and you get gas, then that something is not right. Okay. And this is where this product becomes so important to making your journey far more comfortable in transferring to that natural eating that we promote and teach people to do in TLS. It's not an excuse to eat the pizza. Okay. I just want to clarify that. I want to make sure we weren't sending that message out there. We are saying that this will help you transition to that healthy lifestyle.
Absolutely. The other thing I see quite a lot is think about all the pharmaceuticals that these people are on, and there's so many medications that can really interfere with your body's ability to either get the digestive enzymes from the foods that you're eating or to be able to make them from your digestive organs. So it can really help for people that are on medications that are interfering with their digestive system and their absorption. So my favorite product also. So on to my next favorite product is probiotics. Probiotics 10, there's actually 2 different probiotics, but they're the same ones. One's in the NutriClean line, one's in the probiotics line, but they are the exact same product. I absolutely love this product. I will not go a day without it in my household, my husband and I, but it flies off my shelves. I often refer to myself, when I spoke once at a conference, I said, I often think of myself as the dad in the movie, My Big Fat Greek Wedding. Do you remember that, Dad? What did he use to fix everything? Windex. Remember everything? You got a sore throat? Windex. A rash? Windex. Everything was Windex. I sometimes feel like that with probiotics. It supports so much of your bodily functions. It really is because, like you said at the very beginning, Melanie, the road to good health is paved with good intestines. What better way to have good intestines than with probiotics? I love these. I've looked at a lot of probiotics on the market. There are some very good ones. I think this is probably one of the best I've ever seen for several reasons. When you look, it's called Probiotics 10 for 2 reasons. Number one, it has 10 different species. And when you're looking for a good probiotic, you really want to look at the species. You want to have a good blend of both lactobacillus species, and bifido species. So this one's got 6 lacto and 4 bifido. And, Lactobacillus salivarius, that's one of the bacteria that's found in our saliva that we need. So it really has the bacteria for the whole reproductive system. So I love that. And then it's got 10 billion colony forming units. And that's because a lot of times people say, well, I take one that's got 50 billion or 100 billion. Well, what makes this so special is that 10 billion is going to be active spores that are going to stay active in the body because it has 2 technologies, trademark technologies. One of them is called live back technology, and that's going to allow the probiotics in the live spores to stay alive on the shelf. It's shelf stable. So a lot of times people will talk about their probiotics needing to be refrigerated. And I say, well, that's great to try and keep them alive. But how do you know what happened before you got them? Did the UPS truck break down and the ice melted? Did the store have a power outage and lost it? We don't know. So you really don't know if you're really getting live spores. So I prefer to have that live back technology because it's shelf stable. You don't have to worry about what happened before you got it. The second technology that I absolutely love with these probiotics is BioTract, another trademark technology. And that's a special coating on these tablets that's going to allow those those bacteria to stay alive through that stomach acid. Don't forget, anytime it goes through your stomach, the acid is extremely acidic. That hydrochloric acid in your stomach could kill all that bacteria. That's what the purpose of that acid is for, to kill the bacteria on our foods so we don't become infected. Well, we don't want to kill these good bacteria before they can make it down to their intestines where they're going to do their work and flourish. Now, one little tip that I give to all of my clients and even on the label, but and I've read a couple of studies. I've only seen 2 studies, but it actually makes a lot of sense too. I recommend everybody take their probiotics at bedtime. So I keep mine right by my toothbrush. After I brush my teeth, I take my probiotic. While you're sleeping, don't forget, what do bacteria do? They multiply. So 10 billion spores, colony forming units, is going to multiply all night long. They're going to have that intestine unencumbered all to themselves and multiply. I also say you want your probiotics to be good Catholic probiotics. You want them to procreate like crazy. So while you're sleeping, they're procreating, they're multiplying. And then when you get up in the morning, the intestines are completely colonized with these good, healthy bacteria. Those 10 billion spores might become 200 billion spores. overnight. So we don't need to put in 100 billion spores hoping that 10 billion are going to survive and make it down to your intestines. So it does say on the label to take it first in the morning before the first meal, or it says to take it before the first meal of the day. So I say yes, about 8 hours before the first meal of the day. So that's my tips for probiotics. Again, a lot of bang for your buck. They're really a great deal. I can't get over it for all that it does. It supports the entire GI system. And I have flies off my shelves between these two products. It's just,
I mean, just look at the incredible list of benefits on probiotics. It is so, so comprehensive to our health, for sure. As we talked about that enteric nervous system and the, gut brain connection. So this is where we're really working on that healthy gut biome. So, when I asked you to join us, Tina, I said, which of the digestive products do you want to touch on? And you were immediately like digestive enzyme and probiotics. So I'm so glad you shared with us, because I learned some things. So fantastic. Appreciate it. So Sosan.
Thank you. Well, I have to say that as much as I love digestive enzyme and probiotic, and I recommend it to all my patients, another product that I fell in love with it is the Aloe Juice. So anybody knows what aloe does, right? I always say that when you have a burn, you have a cut, what do? You know what the aloe does. So if aloe can do that much for you externally, think of what aloe can do internally. And so what makes our aloe so great? Okay, let's talk about what makes our aloe so great. Then we talk about the benefits. Because there's a lot of aloe juice out there. But the question is, are they truly all aloe juice? Just because they say aloe does not mean aloe juice. So our aloe is, I think a lot of people don't know that it's actually temperature control processing. And why temperature control processing is important is because we know they are plants. And we know plant gets damaged, or I would say are very sensitive to temperature. Anything increased temperature will lose its nutrient. We know that, right? And this is why this particular product, the Ultimate Aloe, is actually temperature control processing. That means it still preserves a lot of its nutrient, enzyme, and mineral, which is very important. Second, it's actually handpicked. Set by the product that sets a product apart. A lot of them are actually mechanically, like using the machine, which we know are not able to protect that plant. So these two, what makes our aloe very amazing. And of course, you have that International Aloe Science Council, which is IASC certified, that stamp approval, that is the trademark, that's the standard, that's saying that this has a quality. Yep, that logo right there, it shows that it's consistently in ensuring aloe content, purity, and quality, right? So we want that a stamp of approval, and this is that particular it. And on top of that, and I said before, it contains, I call this for people who don't want to take a multivitamin, this is your liquid multivitamin. It's truly a liquid multivitamin. Why? It contains over 200 nutrients, which contains enzyme, vitamins, essential minerals. Isn't that your liquid multivitamins when you think about that? So I have aloe juice every single day. I have it. My kids have it every single day. And on top of that, obviously, it supports a healthy digestive tract. And so that you know that it also supports a healthy immune system. Why? It's because it's very rich in polysaccharides. And polysaccharides are very important in terms of promoting a healthy immune system. And people said, okay, I think this is something that we didn't really touch upon today because we really want to focus on digestion, but 70% of our immune lies in your gut. So if you take care of your gut, you're indirectly taking care of your immune. So think about it. What's the best way to protect yourself? Like we said, that stomach acid kind of kills the germ, but a healthy digestion means that you already have an immune system that's geared towards helping you, because 70% is happy because they sign your gut, and when your gut is healthy, you're at least 70% healthier. How's that? Okay. And on top of that, it obviously helps with normal healing. That's why I said, when you think what aloe does, it does heal, right? When you maybe burn or get cuts, it helps you heal. I like to kind of use another analogy, and I want people to very quickly just think because it helps you heal. Remember I talked about, when we're eating food And our stomach has that coating, that mucus coating. Remember that mucus coating? I said that it protects you from the corrosiveness of the digestive juice. So aloe is help with healing. So I'm not here to talk about any diseases I'm not supposed to, but just think about what they do. It actually helps you heal. So when people has a lot of those common problem where people had those maybe acid reflux or a little bit more of those symptoms, aloe does a great job because of its healing factor. And that's why I love aloe. I think for people, whether you have, it's digestive problem or not, this is your liquid multivitamin with the extra boost of for supporting digestive and supporting your immune system. This is a total win-win for everybody in your family. So that's number one. Second product, which I think a lot of people don't even really talk about this, but it's actually a very important product. It's for people who has the occasional constipation, okay? I know people think constipation is not a big deal. I have to tell you, I'm sure Tina and as well as Melanie will agree with me, constipation is a big deal. It is a big deal. If you going in and you're not going out for a day or 2 or 3 days, for some people it's a week, it's not normal. Okay. So when people say, oh, the next few days I will have it, I always get worried when I hear that, because I was like, would you be okay if your garbage never picked up by a garbage truck for the whole month? Are you okay with that? And they said, no way, it stinks. Guess what? It stinks in your trash. Just think about that. It has to be eliminated. It's the same thing. And this particular aloe compared to our ultimate aloe, this is a neutral clean aloe. It is actually, and people said what makes it different is because they actually take the surface of the leaf that actually gives the help to have a little of the laxative effect, which is different from the ultimate aloe, because we actually take the different part of the leaf. One is more the laxative part. This is put it into this particular product, and the other, which I was talking all those benefits, that was put in the ultimate aloe. So for people who have those occasional constipation, this will be the best product of choice. But like I said before, this is for occasional constipation, but if you have chronic constipation, it's time to really kind of take the whole total comprehensive approach and say, how come I am not moving? There's a reason why I'm not moving. Is it your diet? Is it your sleep? Is it water? There's so many other factors. So this is so important to help. It's safe, is yet effective. It promotes a healthy elimination from the colon. And the most important thing I always say, if you're not eliminating, you have to find ways to eliminate. Then at the same time, work on your lifestyle, on your diet, and TLS exactly. That's why I love TLS so much as a practitioner, is because it's not just a weight loss. It's truly a healthy eating plan for total health. And the side effects or the byproduct of this is you losing weight. As simple as that. And that's pretty much for my part, for my 2 favorite products that I think everybody really will truly benefit from.
Yeah, I feel like this one should be in everybody's sort of medicine cabinet.
Yes, I agree.
It's like, on the occasional time you need it because you traveled, or,
Yes,
because traveling always throws you off, or, you get up really early and you weren't able to have your routine because, whatever reason, right? I find when your morning routine is off, so does your, bowel movement. So there is definitely a time and place for this product, and it works incredibly well. So don't take more than directed.
Yes.
Not if I was 5.
I know it's pretty intense, man. So just take it as directed. I have to say that it really is super helpful. Make sure you drink lots of water when you're taking it, of course.
Yes.
So, we covered a lot of products. Do you need to start on them all? No. Definitely get with the person who invited you here. We also have what's called a nutrophysical exam on digestive health. It's a quiz, a personalized quiz. It's on our other sister website called shop.com. So the person who invited you here can take you through the digestive nutrophysical quiz to get more information on which of these products may be a fit for you in regards to, addressing your digestive concerns and your digestive goals as far as you know, really taking your health to the next level. Again, we feel like this is one of those things that's not talked about nearly enough, simply because there is, you know, as Sosan said in the beginning, number 3. And you know, we really wanted to bring awareness. We went a little over time, but I think we all had fun. Everybody stayed, y'all stayed. So we really appreciate it. I just want to say thank you to everyone who attended and everyone who was on the chat. You guys were just like going nuts on the chat. I hope you were doing the same on Facebook. I want to say thank you to Tina. She's heading out traveling tomorrow. So we really appreciate her time. I know she's got a busy practice and, you know, busy life with what she's got going on. So Tina, thank you so much for being with us.
Thank you so much for having me. This was so much fun, and I learned so much more too. So I love learning.
Yes, exactly.
Thank you.
Sosan, my partner in crime, again, thank you for all of your incredible knowledge. I'm just taking a look at all these fun chats, you guys. Thank you so much for being with us. You guys have an absolutely fantastic night. We'll see you next month. We're always the first Wednesday of every month. And next month, we will be talking about how to create healthy habits. How many of you have ever stopped and started, right? And why is that? And how do we create those healthy habits that stick? We have one of the best joining us on this topic because she has done it. Went from 400 pounds, lost over 212 right now over the last 3 years. This woman has been on fire. You want to hear this story. So join us next month. We'll talk to you later. Thanks so much, everyone. Bye for now.
Bye, everyone.